Hi everyone, welcome back to our medical ethics class. So this week would be our final lecture. And in this lecture, we'll talk about our rights to healthcare. So let's begin with the basic distinction between legal and moral rights to healthcare. So legally, many countries recognize a right to healthcare in places like Britain, Canada, Germany, and the Netherlands. National systems guarantee access to medically necessary services for all citizens, regardless of ability to pay. The United States stands out. Many poor Americans lack insurance coverage, although by law emergency care cannot be denied. But when we ask whether people have a moral right to health care, that is, a right grounded in ethical obligation rather than law, so things become more complicated if you talk about moral rights. Because that we will start to talk about moral rights, we start to talk about what's good and what's bad, and what we ought to do and should do and what we should not do. So that becomes much more complicated than just asking, okay, what does the law require and what does the law prohibit? The other distinction I want to talk about is the positive versus negative rights. So we also need to understand that the right to healthcare is a positive right, not a negative one. So positive rights require others to do something, like providing services. Negative rights require others only to refrain from interfering, so like the right to free speech, where others must not censor you. A positive right to healthcare thus demands that society allocate resources to meet health needs fairly. However, because positive rights demand actions and resource use from others, they are often harder to justify and to decline clearly than negative rights. So there are also different theories of justice, and those different theories, they offer different answers to whether and why we should recognize a right to health care. So libertarians like Robert Nozick argue that forced provision of health care violates individual property rights. For libertarians, charity is a personal, imperfect duty, not an enforceable right. Utilitarians, on the other hand, argue that public health systems can promote the greatest good for the greatest number by reducing suffering, improving functioning, and creating a healthier society. However, utilitarianism struggles with hard cases. Expensive treatments with low returns may not be justified by pure utility calculations, yet many believe we still owe such care to individuals. Russian contractarians offer a third path. So they argue that healthcare is necessary for protecting fair equality of opportunity. Disease and disability restrict our life chances. Healthcare helps restore the normal range of functioning, preserving people's ability to pursue their life plans. Thus, under Russian view, a right to healthcare is tied to maintaining fair opportunity, but it is limited to protecting normal functioning, not maximizing every possible enhancement. Another question you might ask would include, what does a right to healthcare include? So given resource constraints, the right to healthcare cannot mean unlimited access to every treatment. Instead, a system-relative approach is necessary. So the right should guarantee access to a basic tier of services that maintain normal functioning. This includes preventive, curative, rehabilitative, and long-term care for diseases and disabilities. It excludes services that merely enhance normal appearance or performance, like cosmetic surgery or elective enhancements. Moreover, judgments about what counts as effective and necessary care will inevitably vary across societies depending on values, resources, and technological capacity. And there are also a lot of hard cases as well. So hard cases such as coverage for infertility treatments, cosmetic procedures, or mental health services reveal that drawing lines is difficult. So we might want to ask questions like, is infertility a disability that demands correction? Or we might ask this question, should cosmetic height enhancement be covered for children who are short but healthy? So different societies may answer differently. But overall, protecting normal functioning provides a practical, morally defensible boundary for a healthcare right. I think the problem here relies with how to define normal. So philosophers like Alan Buchanan challenges the idea that we must ground healthcare rights in universal moral right. Instead, he argues that multiple overlapping arguments can justify providing a decent minimum of care. So, for instance, special rights such as compensation for historically oppressed groups like Native Americans and African Americans, and prevention of harm. So he argues that public health measures that prevent widespread harms justify government action. Also, prudential arguments ensuring basic health care benefits society by creating a more productive workforce, and also enforce beneficence because it argues that because voluntary charity often fails to meet collective needs, enforcing basic contributions is justified. So this is similar to taxes for national defense. Thus, even without a universal moral right, we have strong reasons to support a decent minimum health care policy. So that's what Buchanan argues. However, philosophers like Engelhardt offers a forcible libertarian critique. So he argues that there is no circular universal moral right to healthcare. He argues that helping those who suffer from natural misfortune, such as illness or disability, may be charitable, but it cannot be morally demanded through force. Property rights and personal liberty impose limits. Individuals own their resources and cannot be forced to redistribute them without consent. So Engelhardt points out that lofty goals like providing the best care for all, maintaining equality, ensuring freedom of choice, and containing costs are inherently incompatible. So he argues that we must recognize trade-offs and limits. So a just system for Engelhardt must accept that first, inequalities in healthcare access are inevitable. Second, rationing of services is necessary. And three, we have to have a multi-tiered system, offering a basic tier for all and allowing private purchase of additional services. So he thinks that this is the only realistic moral solution. And so literature have also tried to write about questions like how should we structure a healthcare system if we accept these moral insights. So if we accepted these, as philosophers have argued, then we might do certain things. So first, we must ensure that there must be a basic guaranteed tier of services that protects normal functioning and fair opportunity. Higher tiers can exist, allowing individuals to purchase additional services as long as they do not undermine the basic tier. Healthcare policy must balance equality, liberty, and efficiency without pretending that all goals can be fully achieved at once. So in other words, we must face the reality of finitude, limited resources, competing moral visions, and the need to set priorities transparently and fairly. So this is just some consequences and implications of the literature that we covered and read this week. But those are not the only answers, and a lot of philosophers do not agree with this. So to conclude, the question of a right to healthcare raises deep tensions between individual rights, collective welfare, justice, liberty, and fairness. There is no single and simple answer, but through a blend of ethical reasoning like utilitarian, Rawlsian, libertarian, and pluralistic, we can craft a realistic, morally responsible framework that honors the dignity and needs of all persons, while respecting freedom and acknowledging limits. So that's all for today's class. Thank you so much. And I hope you all have good luck to your final papers.